All right. Hello, welcome. Good morning or good afternoon, everyone. Welcome to today's webinar. Today is August 29, 2024. It's 1 p.m. Eastern time. So welcome from wherever you might be tuning in from. I'm Bethany Hamilton, Director of the National Center for Medical Legal Partnership. Today's training webinar covers an introduction to performance measurement and evaluation for health center-based medical legal partnerships, or MLPs. Let's get started. Next slide, please. Again, I'm Bethany Hamilton, Director of the National Center for Medical Legal Partnership. I'll be your host today, as well as moderating, but I will soon introduce you to our subject matter experts who will be presenting on performance measurement and evaluation based on their expertise and experience in the field. We also have Reha Manikanasamy running tech in the background. She's our team's data scientist. And so feel free to use the chat if you need any sort of technical assistance. Use the chat to communicate with her or with me. All right, let's go to the next slide. Today's webinar is actually a part of our HRSA National Training and Technical Assistance Partnership work. Through this funding, the National Center for Medical Legal Partnership has been able to provide resources, direct technical assistance, and training such as this webinar to support health centers in particular, as well as lookalikes with their medical legal partnership development and the ability to leverage those strategies to address the legal needs of their patient population. So many thanks to HRSA for continuing to support our efforts to better meet the needs of patient populations, the 30 million that are served by health centers around the country. Next slide. A couple of housekeeping remarks here. So we are all joining on Zoom webinar. You are joining automatically on mute. But at certain points during the webinar, we may actually use or encourage you to use the raise hand feature to unmute and engage. So we do plan to be interactive on today's webinar. You can also engage by using the chat function. Just make sure you use the everyone selection so that you're sharing that comment with the entire audience. And then also, if you have a specific question, you're welcome to and encouraged to use the Q&A function in Zoom. Again, if you do need some help, you can select host and panelists, and Reha and I will be looking out for any specific requests regarding technical assistance. If you need to show captions, select live transcript and show subtitle. I believe someone has already placed that function on. And so a transcription is being recorded for today's event. Next slide. All right, so here are today's learning objectives for the webinar. By the end of today's presentation, we're hoping that everyone in the audience will really improve their understanding of and be able to implement some new performance measures that are tailored specifically for community health centers or their primary care-based MLPs to help enhance the sustainability of those MLP initiatives. Secondly, we're hoping that you will be able to identify strategies for securing institutional buy-in and integrating MLPs into your healthcare delivery model. And then finally, we hope the audience will develop skills or improve those skills in data collection and analysis to better evaluate the impact and effectiveness of your medical legal partnership interventions. Next slide. Before we get into the more technical aspects of performance measurement and evaluation for MLP, we wanted to make sure that we're providing foundational information about what a medical legal partnership is and what are the typical activities performed by medical legal partnerships. So as you'll see on the left-hand side, or the blue area of the screen, we've identified the core components of a traditional MLP, but also a couple of years ago, a team at Georgetown University identified some additional components of an academic MLP. So all of them are listed. You can see the 8 core components: a lawyer in residence, a formal agreement such as an MOU is in place. You've also identified specific populations that you may target for MLP services. You're screening those individuals for their legal needs. You have dedicated legal staffing identified, a lawyer. Perhaps you also are lucky enough to have paralegals, community justice workers, or others, but legal staffing is identified. The MLP is also providing training on social determinants of health, and you're, of course, exchanging information. And then finally, you have designated resources for the medical legal partnership. You can see for the academic MLPs, they really are dedicated to those academic institutions' missions of providing educational goals, pre-professional in this case, or curating interprofessional learning environments, such as grand rounds with the professions, the legal staff, and the medical teams. And then they have a commitment to really advancing the evidence base through research. For all of those medical legal partnerships that are formalized with those components, they're usually conducting activities that fall into the following 4 buckets. So this is on the right-hand side of the screen in the orange. They're providing legal assistance to those patients. They're providing, again, the trainings that build the knowledge of the health center's workforce to be able to respond to those social needs. They're engaging also in clinical level changes that help to shape and improve clinical practices. And then they're also moving way upstream to be able to address policy changes such as regulatory, administrative, or legislative barriers that might be addressed to better serve entire communities and improve population health. So these are the core components and typical activities of medical legal partnerships around the country. On the next slide, you'll see we ask the following question. So you're providing services and you have your workflows in place, but how do you make sure that the program is effective and that it lasts? This is what we're trying to get into today with regard to performance measurement and evaluation. Next slide. So on this screen, you'll see an image off to the right. It's a graphic of the MLP workflow. You can see 4 buckets: screening, legal services, follow-ups, and finally, continuous quality improvement. This is how, when we engage as an MLP, we're doing a full breadth of work that allows us to know whether our medical legal partnerships workflows or operations and its services are actually able to create healthier patients, stronger health center workforce, and reduce those health disparities so as to improve health equity. Let's click the animation, Reha, so that we can pop up a larger version of the continuous quality improvement section of the workflow. Thank you. And you can see that as a part of the work of a medical legal partnership, MLPs are evaluating the impact of their services as well as how they're functioning, right? So the implementation of that MLP, all of those various components, how is it actually working? And then as they evaluate each of those buckets, the services as well as how the implementation thereof, they're also making adjustments along the way. So without further ado, I want to introduce everyone to the subject matter experts who will talk about sorry about that. I got ahead of myself. We want to run a poll first, and then I'll introduce our subject matter experts today to walk everyone through performance measurement, and evaluation. But first, we want to get a better sense of the audience and where your knowledge or expertise or comfort level stands in terms of what we're discussing today. So let's bring up the poll, Reha, and let's ask everyone to engage. The first question is, how familiar are you with performance measurement and program evaluation? You can see we have a range of comfort levels here. So let us know if you are an expert or maybe you're not so familiar, but you're ready to learn. Even if you are an expert, you're here. So let us know if you're still ready to learn. Second question, as answers come in, thank you for everyone participating. Have you developed performance measures for your medical legal partnership? Answer choices are yes, no, or perhaps you're not sure. The third question is, has your MLP conducted an evaluation? So the options here allow you to tell us if yes, you've done so for implementation. Yes, if you've done an evaluation on the outcomes. Yes, you've done it on both implementation and outcomes, or perhaps the answer is no. There are no wrong answers here. We just want to get a better sense of where everyone stands in terms of familiarity and comfort levels with what we're about to discuss. So let's get a few more answers in. Let's see if we can get to about 85% participation. Folks, if you have not participated in the poll yet, we'll give folks about 5 more seconds to get their answers in. Again, how familiar are you with performance measurement and evaluation? Have you developed performance measures for your MLP? And finally, has your MLP conducted an evaluation? All right, let's go ahead and close out the poll, Reha, and show the results. All right. So it looks like there's a I hopefully our speakers can see the mix of results here. So for the first question, it looks like most people fall within the either familiar or somewhat familiar bucket as it pertains to familiarity with performance measurement and evaluation. There's a really good spread here, and a lot apparently for all of us to learn. On the second question, have you developed performance measures? About 58% of you have not yet developed performance measures for your MLP. So really glad to see you here. And for those who answered yes, be really curious to hear from you in the chat or when we unmute, what performance measures have you developed and applied to your medical legal partnership? And then as to the third question, has your MLP conducted an evaluation? Over half of you said no, which is not actually surprising because evaluation is its own set of activities, and not everyone has the capacity to conduct a robust evaluation. So hopefully the information we shared today will be helpful across the board to everyone, because some of you also fall across the board in terms of conducting implementation eval, but not outcomes, and vice versa. All right, so let's pull down the poll and get our subject matter experts introduced to the audience and get started. All right, so for the remainder of the hour, we're going to encourage you to please not only listen in, but send questions that you may have to our three subject matter experts on the screen here. We have James Tufel, who you've probably seen us have on presentations in the past, but helped to author the particular resource that is the basis for today's presentation. He's a consultant for the National Center for Medical Legal Partnership. We also hear from Shannon Mace, an attorney who's executive director of the HELP MLP, has been around the medical legal partnership and certainly part of the NCMLP family for a very long time. And then Ali Kiefer, they're joining us as well from the National Nurse-Led Care Consortium, and Ali is Director of Community Partnerships. James, Shannon, and Ali, thank you so much for joining us today, and I'm going to turn it over to you.
Great. Thanks so much, Bethany. It's a pleasure to be here with all of you today. I scanned the attendee list and there's a lot of familiar names on there, so thanks for joining. We thought it might be helpful before we dive into a discussion about performance measurement to just give you a little bit of context about our medical legal partnership and then the specific project that we're going to be focusing on. So our MLP, the Health Education and Legal Assistance Project, a medical legal partnership, it's a mouthful. HELP MLP was established in 2008 at Delaware Law School, and we really started with 2 law student fellows. I happen to be one of those law student fellows. It was a great opportunity, and many years later, I'm now the ED, which is awesome. When we started, our initial focus was really just on demonstrating unmet legal needs within state of Delaware outpatient facilities in hospitals. So outpatient waiting rooms, we were conducting needs assessments. We used that data to fundraise, and we ended up getting a private foundation grant to actually partner with an FQHC in southeastern Pennsylvania. And that was our very first medical partner, who we partnered with for a year. We had 1 year of funding, and we served that partner for a year. And it just so happened that when we were wrapping up that grant, there was an opportunity released from HRSA to establish a medical legal partnership within the Healthy Start program, which is a federally funded maternal and child health home visiting program. So we applied for that opportunity with the Foundation for Delaware County, and we're lucky enough to be one of 3 projects in the nation to be awarded that funding. And in 2010 is really where we shifted our specialty and our focus to really focus in on perinatal population. So families with young kids and people who are pregnant. Since 2010, we have expanded significantly. We served and continue to serve families in Delaware County, Pennsylvania, but then in 2016, we partnered with the National Nurse-Led Care Consortium to establish the Philadelphia Nursing Legal Partnership. And we partnered with NNCC's maternal child health home visiting programs there. And we continued to implement that project until 2022, a couple years ago, when we received a grant to expand the work that we were doing with NNCC to home visiting programs across the city of Philadelphia through the establishment of the Family Advocacy and Integrated Resources Project, the FAIR project. We started with 2 law student fellows, and now Help MLP is a team of 15. So have really significantly grown and have had different types of partnerships. The FAIR project, like I said, was really an expansion project. With NNCC, we were already providing integrated legal services through this nurse-led MLP model. And NNCC had a separate project called the Family Support Fund, which provides emergency financial assistance to families, which is an essential benefit to them and is a really great complementary program to a medical legal partnership. The FAIR project is supported primarily by the William Penn Foundation, a private foundation. However, we recently received a federal grant from the U.S. Department of Health and Human Services Administration of Children and Families to expand our MLP work through their MLP Plus grant opportunity. And we are also supported by state funding through the Pennsylvania Office of Child Development and Early Learning. This FAIR project really built upon all of the lessons learned that we had over the years of work that we were doing in Delaware County and in Philadelphia before scaling quite largely. And just to share with you some of the results that we've had through the FAIR project since we implemented actually delivering services in February 2023. We've conducted over 1,000 screenings for almost 900 unique participants, received over 1,300 legal referrals for 772 unique participants. And we provided legal services to 789 unique participants, which addressed 2,297 legal matters. And as you can see there, and I'm sure anyone who's already doing this type of work, families come to us often with more than one legal need. We have a big focus and prioritize training. In that 18-month period, we conducted 15 trainings and hosted 5 office hours with our public health partners, and those are more informal sort of drop-in opportunities to have discussions with partners. And just to share one of our outcomes, through January 2024, the legal team obtained 822,901, in annualized financial benefits and costs avoided for families. So getting close to $1 million of return to families through our work, which is really amazing and significant.
Great. Thank you, Shannon. Today we're going to have a discussion. It is in part guided by a brief that was released by NCMLP in 2024 called Fostering Sustainability Through Performance Measurement. That's available on the NCMLP website. There'll also be a link to it in this presentation. I assume the presentation will be shared with the group afterwards, but you can also search for it on the website. So one of the important things when we look at innovations in the world is that oftentimes we get stuck in these pilot and prototype phases, right? So we spend a year or two developing a concept. We spend a year or two developing what that concept may look like as a service. But the next few years, right, of figuring out if this pilot is sustainable becomes sometimes problematic, right? So the goal, if we want to get to social impact, is optimizing our likelihood of getting past the pilot phase and into an integrated project or program phase. And we know that sustainability is a foundation for scalability. Great. Sorry, there's a slight delay with slides. So when we're looking at social impact, some of you will be in different positions. Some of you will just be starting MLPs. Some of you will be scrambling to figure out how you sustain an MLP. And for those MLPs that have sustained, you will likely want to scale. We'll likely be talking a bit more about sustaining and scaling today. Bethany spoke to the idea of continuous quality improvement. That's one thing that this framework for sustainability could be used for. Oftentimes, though, when we're looking at continuous quality improvement, it's looking at what we're doing or what we did in the past and how we can do it better. Another important aspect of what this framework could be used for if you're just starting an MLP is for strategic planning. Thinking about those tick boxes that you may want to hit across time in order to optimize your likelihood to be in a better position in the future to sustain. And if we're interested in social impact, it's not just you or your MLP starting, sustaining, and scaling things, but it's also sharing what we've learned with other people. That's the social part of that impact. And that's in part what we're here to do, learn from one another in an hour, but there's many other learnings that could take place over time. The framework that was developed was based on an evidence-based sustainability framework, actually two of them that come out of Washington University and St. Louis. There's something called the CSAT, which is the Clinical Sustainability Assessment Tool, and something called the Program Sustainability Assessment Tool. The Clinical Sustainability Assessment Tool looks at what dimensions, if we want to sustain an innovation in our project or program in a clinical setting, in a healthcare setting, what dimensions would we want to consider in order to do that? So this framework that was developed was in part based and founded on this evidence-based concept of the CSAT, but we also engaged a learning collaborative to specifically tailor those learnings to an MLP context, in particular, an MLP context that is not only focused on hospital systems, but is also focused on community providers. Oh, I went too far. There we go. So this is the thing that you will hopefully see if you are interested in learning more about this. This is what it would look like if you go to the website. This is the 2024 performance measures and metrics. There was a 2016 performance and metrics for MLPs. Why this is important is it builds additional measures and metrics into MLP that should be considered. The 2016 measures largely looked at, are you offering trainings? What type of data on your inputs are you collecting? And can you make a basic financial case for an impact on the world? This particular set of guidelines is probably more applicable to healthcare settings in a community setting. The original 2016 measures are probably more useful sometimes for a hospital setting. But so this is a more generic framework than the 2016 framework and has a lot more dimensions into it that you should consider. So before we get into our discussion, the last thing that I'll speak to is oftentimes, in my experience being involved with MLP for 20 years now, there's the silver bullet mentality. If we just get integrated into the AHR, if we just get a specific type of funding, all things will be good. Oftentimes those are recommendations or suggestions of things that you could do or should consider, but they're not necessarily the silver bullet for sustainability. So if you want to sustain an innovation or an MLP in the world, what you typically want to do is tick box more things, right? So if there are 35 really important things, you want to do as many of those 35 things as possible. That means also that you shouldn't put all your effort into perfecting one of those measures or metrics. That's oftentimes where people lose time and resources, is trying to perfect something. So if you could do 7 things well, that's recommended, as opposed to trying to perfect one thing. So the first thing that we're going to talk about is the first dimension for sustainability, if you want to think through how to sustain MLPs, and that will be engaged staff and leadership. So within the MLP, what staff and leadership have been engaged, and help MLP will exemplify that through their work. So the first question here is, what providers have you connected with for referrals, and providers like social workers, case managers, these types of folks in the healthcare setting and help MLP?
Yeah, of course. The first answer is our referral partners are the home visiting agencies in Philadelphia. It's a complex, the FAIR project is a complex collaboration with maternal child health home visiting agencies, and these agencies are our direct referral sources. However, there's many ways that folks get connected to home visiting services in general. Primarily through our Philly Families Can centralized intake, who does outreach to health centers, health systems to share not only about the home visiting, but the ancillary services that are connected to it. We've built these relationships over many years with the leadership of home visiting agencies, breaking down the silos of our work. And when this project launched, we knew we'd have to bring them in even closer. And so we built our community advisory project board that meets monthly and is able to hear from each other, hear challenges, as well as concerns that folks want to bring up, and of course, success as well. And this really just creates a lot of trust that we're able to hear these concerns and then address them intentionally. And then, of course, outside of those meetings, we have an open door policy on supporting these members to engage with the MLP with a technical assistance form, as well as being available whenever anyone reaches out.
Great, thank you. And that's something in developing this framework that emerged was a lot of conversations have been around historically in MLP. How do we get integrated through technology, right? Like EHRs and EMRs, things like that. But the people component is remarkably important, right? Because if you don't have the people on board, then nothing gets into the EHR or the EMR, right? And so that's really impactful. Another element that emerged with engaging not only the staff was a leadership. So with your MLP, what representatives are in leadership positions? What does that look like in your MLP? So not only is it that you're working with staff, but you actually have voices that control some power within organizations.
Yeah. So we have the executive director, managing attorney, and supervising attorney that all participate in weekly project leadership meetings, as well as our advisory board meetings to hear directly from our referral sources.
Yeah, and James, I'll just mention Allie's role as director of the FAIR project, so they are the one leading the project overall. So a non-legal team member is directing it.
And that's helpful. I think in talking with people, right? Sometimes people get down the how do we communicate with staff internally? How do we get people involved in leadership internally? But this next part has been a struggle for MLPs historically, is engaging stakeholders that are not in your core group, right? That are not the key staff, that are not your key leadership teams internally. So what we're going to talk about next is engaging stakeholders that are outside of your MLP. And in particular, the first question here is really important. So since MLPs began, where we stand today compared to the past is a people-centered justice movement, right? Same thing in person-centered healthcare, right? So what community members do you have as advisors in your MLP? It's a really important component to make sure that what you're offering is what the people actually want.
Yeah, so primarily the advisors to the project are the leaders of these home visiting agencies, but we also include folks with lived experience that have accessed MLP services, as well as home visitors that are meeting regularly with families. And beyond that, we have a neutral third-party facilitator for our meetings That is, one did really amazing stakeholder interviews across when we started the project to get feedback from folks outside of our realm. And then also, you know, continues to be a person that is able to like give us feedback anonymously so that folks can feel more comfortable actually giving critique to the project, which we really love so we can continue to improve.
Yeah, the unbiased person you could speak to as opposed to telling your boss how your boss may not be doing well is a smart idea. And as an intermediary too, not just for people within organizations, but community members sometimes have a hard time voicing their concerns to the people who have power over potentially services or benefits for them, right? Great. So in looking at like the information, how do you collect and use the feedback you get from these external stakeholders? How do you get the information and how do you use it in the world?
Yeah. So, like Ali said, we have formal and informal processes to get stakeholder feedback. One of the ways was through those stakeholder interviews that are conducted by the third party. We also have a training and technical assistance form that people could submit at any time to give us feedback on quality improvement. And then we also do collect, which I think we'll talk about a little bit later as well, formal survey data with all of our partners twice a year that asks a whole range of questions, a lot of them focused on satisfaction and quality improvement. The way that we apply that data is we are transparent about it, especially any formal data collection. We're sharing those results with the whole team, stakeholders, advisory group. And then we as the project leadership team and the folks who are operationalizing it, we meet on a weekly basis to really just identify areas of improvement and to make those changes and discuss feedback that we receive.
And there were some questions coming in, I think that we'll talk about in some subsequent dimensions about what information do you share in EHRs or EMRs, right? And this, I think, again, will be an interesting learning of it varies a lot across MLPs. So maybe we could hear from Shannon and Ali about what exactly it is that they do. So the next dimension is about organizational readiness. Organizational readiness, if you look at sustainability sort of research, is interesting. So everyone is really confident, especially in the beginning, that the organization is ready to do whatever it is that they would like to do. And then they start doing whatever the thing is that they would like to do in MLP. And they said, well, this is hard. This is different than we thought it would be. So organizational readiness, if you're developing an MLP, is a particular dimension of overconfidence that you should definitely consider, right? Also, there's bolstering, there's other things with funders where you're pitching and everything sounds amazing. But that's different than the actual, how do you do this in the world? Organizational readiness, if you ask people, they say our organization's ready. But then when they start engaging in the work, they find out that maybe they aren't as ready as they thought they were. So one of the questions, which is really important, it is seemingly from conversations with the Learning Collaborative, was how do you build trust in MLP lawyers, right? So they're trusted by your healthcare providers, meaning they're not the people there to sue you for the personal injury case or whatever other things people think lawyers are there to do.
Yeah, James, I mean, this is exactly what you're saying earlier. Like it's all relationship based and it's all like building those relationships together. And one way that we do that is monthly trainings with all of the home visitors that refer to our project. And these are an opportunity for to share expertise in legal issues, as well as get feedback from our home visitors of like what they're looking for, like what information they want more of. We also include all of our legal staff in our maternal child health trainings to create a bi-directional learning to kind of like level that playing field. And, you know, we monitor this ultimately in a semi-annual staff survey to like make sure that we're hitting that mark. And that survey is also anonymous, but it's about creating the relationship and so on. Yeah.
Yeah, that makes sense. And that's been my experience too. It's and we'll see some of these other themes related to those relationship things. Is one of the struggles MLPs have had is not only building like relationships with people that are outside of the usual group, like the external stakeholders, but communicating your value, right? And if you don't have actual connection to other real people in the world, it's really hard to know what they would like to hear and how they would like to hear it. And then that also breaks down trust, right? So it's not just this trust thing with lawyers, but trust also in general communications. The next thing is I think an important question that emerged, right? So my experience in a lot of legal things in the world is you have legal aid attorneys and the like who are already overwhelmed and underpaid, and then they're now managing things, right? Which means that research supports that most lawyers' time doesn't go to lawyerly things, and they get a bunch of management tasks, so they're doing less lawyerly things, right? And one suggestion or question emerged in the Learning Collaborative around the idea of having non-lawyers manage a lot of activity that's not lawyerly work. So how has Help MLP addressed that as an issue?
So when we first developed our MLP relationship, we knew we needed a bridge between the legal work being done and the maternal child health space. And so they hired me. I'm not a lawyer, and my role is to share the value of the legal work being done and translating it into maternal child health spaces. And in that role, I'm able to share the impact of the legal work on not only our families, but also our providers. So it increases the buy-in for organizations to be interested in this work.
And I got a little ahead of myself in the very first question when I alluded to Allie's role on the team. But it's just been a tremendous benefit to have them in that position and really serve as an ally to the legal team, a translator, help us understand the nuances of the different programs that we're working with. It's super beneficial, and I would definitely recommend establishing a staffing model like that.
And so we see Allie has an office, but she's not the legal provider. So what type of space is dedicated to the legal providers in your MLP?
So much space. Just kidding. Our legal team does hold office space within NNCC, and in my role, I'm able to share with my director that like we need this space for, confidential communication, privacy, et cetera, and to really advocate on their behalf to like have that dedicated space. And, it's one thing to have an office, but it's also having them embedded into our space allows more communication and real-time work together with like with our home visiting partners. With our expansion, we have seen the difference it makes to have folks literally in the office, and like it's something that we're like trying to figure out how we can model that beyond the NNCC office and move into other spaces as well.
And I've seen that in other innovations too, is once you start to get to certain scales, how you do business is fundamentally different. It's a challenge across time. The next dimension is related to workflow integration, and I think that's going to in part get at some of the questions around EHR and EMRs. So there's two general ways looking at workflow integration that people bring up. One is like a technological integration, the EHR example, and another one is simply fitting into how business is usually done, standard practices within organizations. So we'll get into a couple questions there. The first one I think gets at that EHR-like question, and this will vary by MLP. How have you developed like a useful, feasible referral system, right? To some people, that means EHR. To some people, that's not EHR. What does that look like to you?
Yeah, so Help MLP has experience with two different partners, and I could say, this part of the planning is definitely needs to be collaborative between both the legal partner and the healthcare partner. And absolutely, you need to get buy-in from the providers who are going to be using it to conduct those screenings and submit referrals. So when we first started, we relied heavily on the National Center for Medical Legal Partnerships iHealth screening tool, which we continue to use but have adapted and refined over time to meet our population's specific needs. In Philadelphia for the FAIR project, we did establish an electronic screening and referral system using an electronic case management system similar to an electronic health record that hospitals and health centers use, but a little bit different. This one's tailored more towards social workers and home visitors. When we were starting to plan what our workflows would look like and what the actual screening and referral tools would look like I said, we knew it was going to be essential to get feedback early and be transparent about the decisions we're making in terms of what feedback we're adopting, what we're not, and why we're asking so many questions. So we conducted formative evaluation. We drafted out a very robust screening and referral form, which admittedly puts a high burden on our healthcare partners. It's a lot to ask them to do that. And one of our performance measures is to have our partners screen 75% of all of the families they serve, which is a really high bar and totally out of our control, right? Other than building that trust and building an effective system that folks are actually going to use and see the benefit in. So we did decide to use an electronic system. It has, in my opinion, it has so much value. I know it's a costly system, but it does make it so much easier because it reduces the amount of duplicative information the partners have to put into it. And our system is built with form logic or skip logic. So only if you answer yes to certain questions, will follow-up questions come up. I will say, though, we had to really take the time to explain to our partners, why are we asking all these questions? Why do we need to know this information? And especially when you're screening for unmet legal needs, building that trust with them that we're not asking just for the sake of asking. We're asking because we're going to do everything in our power to actually help resolve those issues. I will say, we built a slightly different system in Philadelphia than the one that we have in Delaware County. Delaware County isn't using the same electronic case management system that we have in Philly. So we have developed our own electronic form system that isn't fully integrated into their system. And that does mean more duplication of information entered, a bit of a higher burden. It's not quite as seamless, but we're meeting them where they're at, they're meeting us where we're at. And until, we continue to make those improvements together, it's working. I think another real critical thing is whatever system you use, you have to acknowledge to the person that you received the referral, like just continuously communicating, being transparent about why you're asking for the information, then letting the people know you received it and what your next step is.
And I think you led into the next question in part, right? Which we know you're trying to be more efficient through this, sort of electronic system by hiring allies so lawyers could do more lawyerly work, right? But how do you prioritize those complex legal needs where there needs to be this tailored legal advice or other legal help versus giving guidance, right? Consultations or legal information. How have you prioritized those issues of what your priority needs are to be met by lawyers versus maybe information giving so other people could handle some of the work?
Yeah. So I think the way that we look at prioritization is where can we have an impact? And then thinking about what legal issues are more proximately directly impacting health and outcomes for the families. I think like a lot of medical legal partnerships, most of the cases that we handle are related to housing and utilities, followed by income and insurance, so public benefits matters. However, we chose to be as comprehensive as we possibly can. We have specialists on our team, excuse me, but we also have folks who are more generalists. And wherever possible, we try to provide individualized, direct legal services to a person. We're also trying to resolve as many clients' needs directly as we can, but that's definitely not realistic. So there are certain areas that our team has built excellent referral relationships with organizations in Philadelphia. And I see some folks who we refer to on this webinar right now, and can't thank you enough for those great working positive relationships. So we've vetted who we're referring to and can make those warm referrals and know with some level of certainty that our families are going to receive high quality services. And I will say, this is something that you have to continuously assess as well. We're far along now in our project where we are seeing the highest number of referrals come in. We're starting to hit capacity among our legal team, and we're starting to have those conversations again. Where do we need to reprioritize? What other referral relationships should we build? And one thing that we haven't talked about is we did add an additional team member who's a social services navigator supported through that MLP Plus grant, who we're really excited about and hopeful that that person will also be assisting with non-legal social needs, things like applying for benefits, applying for utilities assistance, applying for or obtaining vital documents, things like that. So also thinking creatively of how to expand the team beyond legal providers to help address those issues.
And I think this next one will lead into some subsequent questions, right? So some things may be overlapping. And maybe overlapping some questions that have emerged in chat, right? So the next dimension is implementation and training. Ideally, when we engage in implementation and training, we should use evidence to, do those things. There are better ways to train and better ways to implement. A lot of times it's just developed as it emerges into the world. But one basic thing, at least we know that seems seemingly important in trainings to get people buying into what they're about to do is successes and impacts. How do you share the successes and impacts of your MLP during your trainings, right? And who's hearing those messages?
Yeah, so I mean, our monthly trainings are directed at the providers, and so I think like knowing your audience very important. And the thing that gets them most interested is like case examples of how this works and what is the value to me. How is this really going to impact the families I'm working with? And so at every training, we use case examples to say like, here's this legal issue and here's how it works and here's how we can help, and with a real case example. We also do an annual event where we do share those. We share the financial impacts, the numbers served, the broader impacts. We do that annually as a celebration event. And this is all in tandem with national conferences and wanting to get the word out so that we can continue to build that energy around it.
Oh. You're muted, James.
I apologize. I'm clicking on too many buttons. The next two dimensions I think are related to some of the questions in the chat. The dimension 6 is about what data do you collect? Dimension 7 is about how do you make impact or effectiveness statements out of that data. What's interesting is when you ask people, can you make meaning out of your data? They say yes. And so the dimension 7 is perceived as easier. But then you ask them, can you collect this data? Can you monitor this stuff? They say that's harder, right? So there's another paradox here where people are confident that if they have the data, they can do something with it. But oftentimes the challenge is in simply getting the data, which is dimension 6. So what data do you collect?
We collect a lot of data, and I will say now is when I plug James Tufel as an evaluation consultant, because we did partner with him very early on in our MLP planning to really prioritize developing and implementing evaluation plans early. We knew it was going to be critical to our sustainability. So definitely encourage folks to reach out to James or someone like James to help think through some of this stuff. We collect a lot of data, like I said, in terms of legal services data. We are collecting client demographics data, referral source, including by home visitor. And we collect that data to share it back to the program so they can see which of their staff are referring, who isn't, where they're, where extra education or training or conversations might need to be had. We collect the legal issue, of course. We do not track time spent on cases. That is a gift I've been able to give my team, and I hope it never changes. We're lucky enough that we don't have any funding sources that require that of us. We do, however, track number of days legal cases are open, type of legal service delivered, and then the case outcome in terms of legal services data. And I know you have other types of data to come.
So once you gather that data, what cases have you made? You already shared that you make material impacts on people, right? There's amount that of benefits that go to people, or debt averted, these types of ideas. Do you also track sort of the psychosocial impact on participants, like their stress level? Are they getting whatever they want out of the service, beyond the more objective material benefits to people?
Yes, so we are collecting both, and to the anonymous attendee who talks about the challenges with measuring health outcomes, we share that as well. We don't have research funding to design, a randomized control trial to demonstrate that we're, truly improving health outcomes among our population. However, we do try to collect and report on that as much as we can within the capacity that we have. And the way that we do that is through client self-report. Every time a client has a case closed, we reach out to them to complete an electronic survey. And in that survey, we're asking questions not only related to satisfaction across a variety of different domains, including trust, respect, etc., but also things like the impact the services have had on their stress, their quality of life, their health, their relationship with their children. And with that, we also, of course, ask if they, how the outcome of the legal service impacted them, and collect a lot of open-ended qualitative data. We will also be conducting key informant interviews with clients to get richer, more qualitative data as well.
And so a lot of the questions in MLP have been around things like the patient experience, the outcomes of patients, or the outcomes of clients, and then maybe issues of costs averted, right, to either the patient or to a system. In the quadruple aim framework, something that's really important, especially seemingly in stressful jobs like those people working at community health centers, legal aid, is monitoring the provider experience, right? So people, are not burning out and are finding their jobs meaningful. How do you monitor the provider experience in your MLPs, either on the medical or legal side, or both?
Yeah. So we have a partnering staff survey that goes out to both sides, our home visiting partners, our public health partners, and legal staff. And we administer this anonymous survey twice a year and ask a lot of questions. Folks are luckily happy to answer it so far. We're asking satisfaction, not only related to the project itself, but getting at that provider experience. We ask questions related to how this project has impacted their job satisfaction, their satisfaction in terms of their relationship with their clients. We have for many years been talking about ways in which we might be able to design a retention study, but haven't figured it out just yet. So if anyone has any ideas about that, we would love to talk with you. Our hypothesis is that and related to their stress as well, which you had mentioned, James. Our hypothesis is that having a service like this available to our public health partners, and similarly having a model such as ours available to our legal team, that we are reducing that work-related stress, improving the quality of their jobs and employment, and ideally improving that relationship with clients on both sides.
And as one follow-up question, because I think this emerged in chat, is the idea of connecting the legal work with health outcomes, right? Have you looked at that? And I know, for example, there could be indirect ways to get at this concept, like adverse childhood experiences, right? You're trying to alleviate those in families, stress of people. Have you explored those connections at all between the legal work and health outcomes?
Yeah, and that's we rely on connecting the dots, right? So going back to the material impact question, we are documenting as many material impacts as we can. Evictions prevented, housing conditions improved, lead abatement, connecting people to benefits, averting debt, you name it, we track it or try to track it. So when we're making the case to the potential health impacts we are making, we rely on the existing data to connect those dots, right? We know that a person with an infant is going to have better outcomes if they have stable housing than if they are living outdoors.
And the last dimension, this is the one that isn't part of the CSAT, the Clinical Sustainability Assessment Tool, but is part of the original Program Sustainability Assessment Tool, and it focuses on funding and financial stability. So I know, Shannon, you spoke about some of this in your opening slides. But the type of funding that supported you specifically, like, you know, the state or federal public funding, right, that supports your project.
Yeah, so right now the FAIR project is largely supported by a private foundation grant, but we are committed to diversifying that funding, and we know we need to find other funding sources to sustain the work. So we have been and have had some success exploring federal grants. We have state funding that comes through the maternal infant child health program. And we are very much interested in insurance support for these services, and we do track. That's another data point that we track, which is the health insurance plan of every one of our clients, so that we can build the business case to show the Medicaid managed care organizations in our region, look, we're serving your clients, obviously in an unidentified way, and demonstrate the services that we have and the impact that we have. I will say in Delaware County, we do have support from Medicaid managed care organizations already.
And I know this is a lot to cover, 14 years of work and the ups and downs, but just briefly in how you spoke to this, it seems like you've had diversified funding across time that, you know, or at least you've learned to diversify after maybe you had siloed funding? Can you speak to that diversification of your funding across time?
Sure. I mean, our first year was one pilot, a private foundation grant that it was not renewable by the nature of what it was. And our efforts to joint fundraise didn't go anywhere at that time, and we had to look for other funding sources. So sometimes, and unfortunately, it's by necessity. And I think this is something, certainly on the legal services side, folks are familiar with, the fear that at any given point, a particular grant will go away or will end, and having those different funding streams is really essential. And with that comes with additional reporting burdens and managing different funding streams. And, it's a challenge, but at the end of the day, I think it's much better to be able to rely on several different sources of funding than one source only, until one
Thank you.
very rich person wants to pay for all of our work.
So thank you. And the resources up here in case you're interested in learning more. The performance measures for 2024 go beyond some of the traditional program evaluation metrics, and that's really important as we exemplified today through Help MLP's work. We can't just simply be presenting like healthcare recovered dollars. There's a lot more to sustainability and these other dimensions to make your program work across time. So I think that's all we have. And Bethany, do you want to close it out?
Sure, but not before saying thank you to Shannon, Ali, and James for helping to share your insights, expertise, as you also continue your MLP journey and research and evaluation work. So thank you so much for sharing your knowledge on today's webinar. And I also want to sincerely thank the audience for being really engaging during today's 1 hour presentation, where we packed as much as we could in on these 8 dimensions and also did some level setting at the beginning. Before you leave today, please, in the chat, download that new brief so that you can walk through each of those dimensions in greater detail with your medical legal partnership teams or stakeholders, or, to Shannon's point, those funders or potential funders of medical legal partnership. Also, please fill out our evaluation. Reha and I have been plugging it in the chat so we can find out how helpful this webinar was, and then what else we can provide in the future with regard to trainings. And then some of the questions that actually came in, I just want to make a quick point pertaining to compliance with regard to HRSA or BIPIC. So please reach out to BIPIC in particular if you have a HRSA or health center compliance related question. We can also share that in the follow-up posting for the recording for this webinar, in addition to the other resources. But otherwise, please feel free to reach out to us if you have additional questions or want to send a question or comment or remark directly to Shannon, Ali, and James. Happy to field those on their behalf. You can email us at ncmlp@gwu.edu. I said it really fast, but it's also on the screen, and these slides will be shared. And then also, we're just asking folks to please sign up for our bi-weekly newsletter, the MLP Update, and we'll share that link as well, but it's also on our website. We hope to see everyone soon again on future webinars and learning collaboratives. There's much more to come this project year across our multiple projects. Also, just want to put in a plug for Ali's team at NNCC. They are also HRSA funded national training and technical assistance partners. So take a look at what work they are also doing to provide health centers in particular with the support and resources they need to better meet the needs of their patient populations. That's a wrap, everyone. Thank you again for joining us today, and we'll see you on the next training event. Take care.